How does one know that one has varicose veins? Varicose veins, of course, you can see them, but whether they are actually pathological, which means that they warrant treatment, is something that one needs to know. What are the symptoms? Initially, when they start, there is a little mild ache only when you are standing or sitting with your legs hanging down. The pain is not constant. It only comes on whenever there is exertion or when you are sitting and standing. This can then eventually manifest itself as a burning pain, as a tiredness, as a heaviness in the legs, which is there at all times. Now, this can actually further progress when you start itching in your ankles, in your in the legs, and that itching can then lead to ulcerations. And because of this itching, the swelling increases. The swelling will increase because of constantly sitting or standing at long periods of time, and this swelling and the itching can actually combine and cause what is called an eczematoid dermatitis, or an eczema-like condition in which there is weeping of the wound. The skin starts to leak fluid, sometimes gets infected and leads to ulcerations. Sometimes a catastrophic event occurs. One of these veins actually ruptures. It ruptures when you least expect it, when you are sitting or standing, bathing, or even sleeping for some matters. Sometimes it actually ruptures and the blood flow is absolutely catastrophic. You can bleed so heavily that it can actually lead to a circulatory collapse or a fall in blood pressure. So that is something that one has to be extremely careful and worried about. Other than that, apart from the cosmetic part, which means that they are obvious and they are present and there is a little bit of heaviness and discomfort, they usually don't cause much complications. But bleeding and ulceration are the two huge risks which one has to completely, definitely avoid, which is the reason why treatment for varicose veins is essential and must be done. Do not ignore them. Thank you.